AM 1220 KHTS. I am T, and you are listening to Dr. Proctor, a show that we bring you the first and third Thursday of every month. This is an opportunity for us to peek over the shoulders of the medical community, kind of find out what's going on, what they're talking about, a chance for us to have an informal conversation, literally over, well, a cup of tea, so that we can demystify some of the things that are out there so that we become our own best health advocates with everything that has changed over the years with medicine and the way people have such access to health care. The better we can make our visits to the doctor, the better we will be in the long run. So we try to bring in different topics and different members of the medical community so that when we have opportunities to have to go in and see the doctor, we are well versed in what we need to be asking, what we need to be listening for. And with the silver tsunami, we have more and more injuries that will become, age-related, just simple wear and tear. And with me today, we're going to talk to Tom Burton. He's the orthopedic program manager over at Providence Holy Cross Mission Hills. He's a physical therapist. And Tom, hi, welcome to KHTS, to the Dr. Proctor with me.
Hi, T. Thanks for having me.
All right, physical therapy. I want to talk a little bit about that because on a number of levels, because we often hear the words physical therapy and we think, oh, that's someone coming back from an injury or a car accident. And I'd love to know a little bit about how you came to be part of physical therapy and your training. So it's the Tom show.
Well, I'm not just a therapist, but I'm a member. I was a patient for years going through high school as a baseball player with my own injuries from sports. And one day during the summer after I'd graduated, my physical therapist had said, hey, Tom, I could use some help. Would you be interested in working part-time? And I had time. So
and this was
sure.
When you were in high school still?
This is when I was in high school. And so I worked as an aide with FACE when they contracted their therapy. And I was just kind of assisting, in the mornings, 5 days a week. It was great. And I looked at what they were doing, and I was a chemistry major when I went into to school at UCLA. And I thought, this is interesting. I can do this. I can relate from so many reasons because I was a patient with my own injuries and such like that.
I think that's nice for a patient to have someone who has that relatability, because when you've been in the trenches, you have empathy for the person you're treating.
It's true. It's true. And, I've always joked around, if you always have car troubles, your best second car is a tow truck. So, and so it seemed like a great profession for me to be able to move into. And I really enjoyed it. I went ahead and took a look. UCLA didn't have the program, and ended up going over to Cal State Northridge, which has had a burgeoning program, which is now a doctorate program now. And the rest is history. So 27 years later, the body doesn't quite handling the day-to-day treating anymore, but the mind is staying pretty fresh.
But so do you still love it? And have you found that over the years, I think we all have the concept of physical therapy being with the weights or being with the equipment. Have you seen a lot of changes over the years, or has physical therapy been one of those practices that is pretty tried and true as far as patients are concerned?
Tremendous amount of changes, actually. And I was thinking about that as I was coming up today. The insurances are putting the full court press on us to try to shorten our treatments, and they're getting decreasing reimbursement for any treatments or putting more responsibility on the patient, almost like it's a punishment, that they have to come to therapy. But what I have found is that a preemptive attack is, a lot of cases, a lot more effective. Unfortunately, it's not usually covered by insurances, but we find that if you can do a little bit of treating, some body work and the such like that, all of a sudden, people are, not only are they feeling better, but they're progressing better. They're able to participate in their life much more comfortably. It's been a big eye-opener, because I can remember first starting, it was, they came in with a knee problem, you treated the knee problem. You never looked north, you didn't look south to see.
And the whole body.
Right, and it's truly, that ankle bone is connected to the knee bone thing. That kinetic chain is really does exist. And sometime in August, I'm supposed to do a talk down on the other side of the hill, how a stiff big toe can cause a headache.
How a stiff big toe can cause a headache. Now, my brain would want to believe that has something to do with with acupressure, or I mean, you hear all these things. Can you give us like just a little idea of where that talk is going?
A little snippet. Yeah. So the stiff big toe, when you walk, you roll over your big toe, and
It's kind of in the way.
That's part of our leverage. And if it's not bending, you can't roll over it. And so, we do a couple of things. So we compensate. We're amazing animals. Our bodies can do an awful lot of things mechanically. So I can make a couple adjustments. I can either hyperextend my knee so I don't have to roll over my foot, or I can just turn my foot out, kind of dancer-esque style, walking with my feet in a turnout. Now I don't have to worry about my big toe because I'm now rolling through my arch.
Oh, but then that's hard on other parts of the
And
body.
that
I
causes
want you
it
to know that under the desk, I'm actually, and the intern will tell you, I'm actually testing my toes out. Well, yeah. So if you start to compensate, now you're hurting other body parts that are getting involved.
Correct. So you're creating stresses over, there's things like shin splints or posterior tibialis muscle tendonitis. Which can cause pain up in the insertion of the muscle in the shin, which we know as shin splints. The knee can be irritated. By turning out, it changes our balance. So now we have our center of gravity changes, and we have to arch our back a little bit. And having our back arched a little bit puts a lot of pressure on the low back and decreases mobility. But when we were kids, we've always wanted to have our eyes even to the horizon. You can have a baby, and if you just tilt it a little, its head will always go so its eyes are even to the horizon.
Right.
And we keep that. And so if we arch our back, we look up at the ceiling. But if we want to stare ahead, we throw our head forward. Now when our head's sitting in front of our shoulders, the small muscles in the neck are now holding up the head from falling into your lap. And those muscles, when they become overused, they start to spasm. They can become tight, become trigger points.
We are complicated.
And they refer pain to your head.
We are complicated.
And yet so easy.
And the idea that physical therapy, often we'll have people say, well, I'll go to physical therapy when I have the injury. And like you were saying, treating the whole body, if you can implement, I'm sure, some of the exercises, certainly strengthening exercises, core exercises, you start to take care of some of that. And you guys too, I'm sure you can speak to this, have been impacted also with a lot of people coming in. And as I mentioned before, this conversation about the silver tsunami, we are as a nation aging rapidly, and you get a car, and if you use it and you use it and you use it, things start to go. It's the same thing with our bodies. Even the healthiest of the healthiest, I feel like there are things that can go sideways. And physical therapy, you're going to be one of our best friends. We need to know you.
Oh, we're a nice group of people. And with my role, actually over at Holy Cross, I am heading up the total joint program. So it's very funny that you bring up the car analogy, because it's true. Regardless of how well you keep your car up, your tires are going to wear out over time.
Because of use.
Because of use. Not inappropriate use, just use. It's mileage. It's never age, it's always mileage. And so the more miles you put on yourself, the better the chance things are going to wear out. We're not perfect. The tissues are not perfect. Things are going to start to break down. And it's really indicated. We can see that the total number of total joints is going to be like 1.2 million this year, knees and hips.
Wow.
Compared to where it was like 700,000 maybe a few years back.
Right. And that's just a game of numbers. And because of the bodies and the body count, what are the number one, besides like the sports injury, like you're talking about yourself when you were young, and you will see the young people come in having been on the football field, whether it's tennis, that's something, overtraining and overstressing. What are some of the common things that you see just on the average bear, just, coming in saying, hey, this happened, besides not a car accident, nothing traumatic, just the wear and tear? What are the number one things you see?
Back and neck.
Back and neck.
Back and neck pain. And, as I told my students, because I teach at CSUN in their program, they're coming into a wonderful time of to be able to practice, because if you're looking down the street, all you see is people staring down at their phone.
Oh my gosh!
And that's
tech neck is what the plastic surgeons call it, because everybody's get at that turkey waddle even sooner now.
Exactly.
So you guys have it the back side of the neck starts
exactly.
to go.
So you figure if your shoulders are always rolled forward and your head are down, then all of the muscles in the mid back and the upper back are always contracting to try to hold you into that position. And
they're
over time, they
cheesed.
fatigue. And
They're mad.
When they're pissed, they get really tender. And then the low back's the same thing. So the low back, we bend, we twist, we don't have strong core, we don't stretch appropriately. Our choice to pick something up off the ground is just to lean over to go get it, as opposed to actually go down onto a knee or squat using the big muscles.
Right.
Your quads can lift 3 to 5 times your body weight.
We're like ants.
We are like ants, exactly. So, but
if we do it
use
right.
our back,
Right,
But
right.
if you choose to use your back, which is muscles the size of your pinky, most of us, when we put our pinky next to our thigh, the thigh is going to be a little bit bigger.
Going to win every time.
Every single time. So we want to use those big muscles.
Right. So now with the technology causing some problems, the other thing is we used to be a nation of people, especially starting when we were kids. You'll hear people, they were riding bikes and they were out in the street and they're playing kickball, and we were active from the time we were young. Now that's not the case. For the most part, we're sitting in this weird like loser, right? Isn't it? In this loser position, and as a result, do you see in your 27 years, Tom Burton here, by the way, Providence Holy Cross Medical Center. He's the orthopedic program manager at Mission Hills, Providence Holy Cross. In your 27 years, have you seen the changes I know we talked about the medical changes and the uptick in learning. What about in the bodies? It's the neck, it's the lower back. Do you find that some of the issues that affected the aging population starting a lot earlier than you did?
Yes, and I was going to say, when we're looking at the number of total joints, let's use that for example, we have people now in their 40s having total joint replacements. I've seen as young as in their 20s.
Wow.
Because of rheumatoid arthritis.
Right.
But it's becoming more
But
common.
also habit, what we're doing.
And it's, we break ourselves down. Now, there is something, cartilage gets nutrition through compression and friction, and that if we aren't really active, that cartilage can become soft.
So you're darned if you do, you're darned if you don't, and somewhere in between there's moderation. That's the right way to live.
It is the secret to everything is moderation.
Right? All right, so if we're seeing the aging issues, I have to think, we've seen a lot of articles talking about, okay, we have the population, certain things are going to show up. Now the idea that a lot of those things that we wouldn't have seen until 50, 60, and we're seeing earlier, as a physical therapist, if you had to talk to kids coming up through the ranks now through school, it's still a good job, right?
Oh, it is still a good job. I think we will always have a purpose within the medical field, by all means. And I do believe that conservative care is going to be relied upon more and more over time. One of the things that we find is in California, we have direct access now, which means that a patient can actually come in and see a physical therapist without actually requiring the prescription.
It used to be, you had to get that from your primary physician or the orthopedic person, whoever you were dealing with, to get physical therapy. That's not the case.
It's not the case. And most insurances now will cover that. It's a requirement for them to follow through with that. So we can actually see people without that prescription for the first month. And then if it looks like something needs to be continued, we'll have to refer back to the physician, which is fine.
How fine is the level of care that a physical therapist can offer? Let's say you're sitting at a desk, you're there 60 hours a week, and now you realize, I've got some aches and pains, and I really want to take care of some things that are being exacerbated. If for physical therapy, are we talking mostly the back, the hips, the elbows, the knees? How finite does that care? Where does it stop? If the wrist is hurting from the mouse, do we now go to an occupational therapist? Break that down for me.
Okay, so yes, so the idea of subspecialty basically is what you're talking about. Physical therapists do have a tendency to subspecialize themselves. When I was in practice up here with Hands Plus Physical Therapy, we had an occupational therapist certified hand therapist and a physical therapist certified hand therapist. So both OT and PT could be certified hand therapists, which require a specific amount of training. It's recognized by the state, recognized by the insurances as well, for a level of talent to be able to care for people with hand.
And it's all connected,
stuff.
so I have to believe you all need to be in communication. As you were saying, the hip bone connected to the knee bone, blah, blah, blah. Same thing with the arm. Someone comes in for tennis elbow, and then maybe you realize, oh, they're also doing a lot of mouse work. So you guys work in conjunction with one another in care?
Absolutely, absolutely. And it's required. You actually need to be able to do that. And you also have to be able to realize that when it's out of your scope, to step back and make sure that that patient's going to the right person who will be able to carry on from there. And then one of the hard parts that I find is that tennis elbow that they're dealing with, is it truly tennis elbow or is it a result of something else? And that's really, I think, part that's really kind of made my portion of my latter part of my career really interesting and kind of difficult, because nothing is as it seems.
It's not just black and white.
It's not. And I was covering a pro-am for tennis back in November last year, and one of the amateurs came up and had said, I've got to be able to play for like 3 hours, and I've got to be able to grip a racket, and I haven't been able to do this for 8 years. And so he said, I have something wrong with my forearm. And so I took a look at the forearm, but I said, it's not just the forearm. I said, it's all connected within the chain. And so we did some treating of the wrist, treating of the forearm. This took about 15 minutes to do. Treating for the shoulder, opened up the shoulder, stretched out the shoulder blade, and stretched out the neck. And all of a sudden here was able to play for 3 hours.
Wow.
And now he's become more of a private type of a client. And with that, as we've been treating, he's now back to motorcycling. He's back to working out. He's working with his trainer. He is now back to playing tennis with less pain, and because now we're starting into recovery mode.
And what's lovely about this is we're not talking about cortisone shots and taking pain relievers. I mean, we just heard the news that Prince was someone who had tremendous amount of pain and had some reliance on painkillers. If you can start to treat the body with the appropriate muscle groups and taking care, it's such a better path to longer health if you can avoid that. So how wonderful that physical therapy was able to be a part of that. When we're going to be taking a break in just a moment, and when we come back, I want to talk about some of the modalities and some of the things that you're doing for patients that are coming in for various issues. Again, we're talking with Tom Burton, who happens to be a physical therapist, 27 years, and I love the idea that you said you're also a member because you've had your own injuries, so you're one of those empathetic physicians. We all love that. He's the orthopedic program manager over at Providence Holy Cross Medical Center, located in Mission Hills. You can always Google them to find out more. You guys have a pretty extensive and wonderful facility there. From, again, whole body. You're always looking at the patient as a whole person, and I appreciate that. And I always say that the more we can do too before we come to see you, and that's the other thing I'd like to cover in the break, some of the things that we can do to prevent having to see you, as nice a guy as you are. I think that if we can kind of trim your scope down a little bit so that you're not completely overwhelmed, it'll make you happier, it'll keep us happier, it'll make us healthier. So when we come back from the break, we're going to cover a little bit of that. You're listening to Dr. Proctor here on your hometown station, AM 1220 KHTS. I encourage you to go to our website, hometownstation.com, for past segments of Dr. Proctor. We're here every first and third Thursday of the month. We'll be back after these messages from our fantastic sponsors.